I'd like to talk to you about what men taught me over the years that we were developing the concept in birthing better skills. What was it that they wanted? Well, first of all, it's simple. They wanted the mother to be healthy and their baby to be healthy. And they didn't want the woman or the baby to suffer. And they wanted the woman and the baby to recover well and be happy. And they wanted to know what to do. So once again, this is looking at the gaps and successes and how skills fit into those three issues. You want to have a healthy mother and baby. You don't want them to suffer, and you want women to recover well. And what can any of us do, much less a man? Because we have had for a long time, particularly in Western countries, a strong belief that men and women are very different. Famous book, men are from Mars, women are from Venus. Yet what did Birthing Better families discover when we evolved the Birthing Better skills? We all blink, we all cough, we can all tighten up our rectum. We're all one humanity. The concept embraces that 100% of pregnant women will give birth. So we could step outside the division, and men, as human beings, and as fathers and partners, could easily become skilled. How do men deal with the present choice-based trend of childbirth? Well, they try to support women's choices. They often think women are nuts. They're willing to sort of accept anything, given the conditions, that the mother and the baby are alive and healthy, that the mother and the baby didn't suffer, and that the mother and the baby recovered well and are happy. They don't care how you got there. They support both the medical approach to that and the non-medical approach. They just want results, and they want to know what to do. And they want skills. Some of them think that birth is women's business, without a doubt. Many men just want to crawl up inside the vagina or to be pregnant for a day and feel a baby kicking them. Men are fascinated by pregnant women's bodies, and they're also turned off. Many times in my experience working with families, men were much more involved than women were for innumerable reasons. But as we developed the skills, what men told me is that the skills helped them change from seeing their partner as a sexual emotional relationship to having a relationship to the woman and their baby that would help protect both the woman and the baby by preparing her body for birth and helping her work through the activity of birthing her baby. And they took this role very seriously. They took the role of becoming a father very seriously. They realized that life had changed forever as soon as the woman was pregnant. And like all human beings, they want to feel skilled. But pregnancy is such a black hole. We just all fall into it. Men don't know what to do. Women are changed profoundly. Women don't often know what to do. They're adjusting to this new life growing inside them. And men were not always, and still are not always, involved in the antenatal care. And they want to feel more comfortable in their role as a father and partner. Because now many women expect men to have responsibility in raising the children. They want skills. What Birthing Better men or fathers taught me in the first 25 years, in the 70s, 80s, and 90s, as Birthing Better skills were developing, was that many had used Lamaze and Bradley, and they wanted skills that adapted, adjusted, were broader, more developed. And in the first 10 years, in the 70s, we just focused on better breathing, better communication, and better touch. But then in the 1980s, Lamaze was going out of fashion. Information-based childbirth education became the norm. Men were changed from being the coach to being the support, and they didn't know what that meant. They could understand supporting a woman's choice, but they didn't always agree with women or know why they should agree. And the concept to protect the sacred space, that just went right over their head. For those families that were going into the hospital to birth, there isn't any man who could see themselves standing up against the professionals in the hospital or in a birth center. And they didn't want to stand up to midwives who were coming into their home because they felt that women trusted the midwives. So protecting the sacred space was uncertain to men. And in traditional communities where I've lived, women either went off by themselves, they went off with family member women, or they just birthed wherever. But in the 80s, when men developed the body skills, it was in response to the societal change that led to the increase in cesareans. And the next group of men in the 1980s realized that the 6 months from conception to 24 weeks, when they would start using the birthing better skills to prepare the body and start learning the skills to work together in the birth, they realized that that 6 months was empty of skills, and they wanted skills so they could keep up with the rapid changes that the woman was experiencing once conception occurred. And always men and women both wanted to have a continuity of skilled selves, so that when the baby was born, they felt confident and competent to begin to parent. As human beings, we have to always remember that we all blink and can cough and tighten up our rectum, and that there are different roles when pregnant. The role of the pregnant woman is to be in the experience, and the role of her partner or other is outside the experience. In other words, they can see and hear things that women don't often know they're even expressing. Someone outside the experience of pregnancy is always trying to keep up with the rapid changes, and women give very confusing messages because many women don't understand the changes. And there are so many different cultural norms, or in modern societies, no cultural norms. And what we found was that families loved the birthing better skills because they were done in the privacy of one's own home. This is where men acknowledged that there were 5 phases of pregnancy: conception to 12 weeks, 12 to 24 weeks, 24 weeks to 36 weeks, 36 weeks to the birth, and then birth itself, because women were still pregnant until the baby came out of the body. And they developed 10 skills that they would use toward themselves, towards the mother, towards the baby, and to know that those 10 skills could morph in any of those phases, and that having skills that changed and could be used for all 3 of them, themselves, the mother, and baby, gave them this sense of continuity of skilled self. What were some of these pregnancy-related skills? Patience, kindness, having a sense of humor or lightening up the situation, seeing what needs to be done and doing it, awareness, developing a second set of hands, a second set of eyes. Very practical skills. So for instance, patience. Couple gets pregnant, and within that first 12 weeks, the woman changes dramatically. You imagine using patience as a skill towards yourself, towards the mother, towards the baby? Of course you can. Can you imagine using humor or lightening up the situation? Yes, of course you can. The second set of arms, second set of eyes might not develop if it's your first baby until towards the latter phases of pregnancy. Seeing what needs to be done and doing it is appropriate for any of the phases. And those skills aren't just for men. Women should use them as well in order to have this continuity of skilled self. And then at 24 weeks, you continue to use those pregnancy skills, but within birthing better, you can start to create space in the pelvis and have internal softening to help the cervix dilate so that the baby can come down through and out the pelvis. If you're going to have a cesarean, then you just enjoy preparing your body. You get closer together. You develop confidence and capability. And if you're laboring, then you know that helping your baby come through your body helps you to have a more progressive labor. And you can use these skills in and around all of the assessments, monitoring procedures, and in all circumstances. At 32 weeks, 80% of the fathers were more than willing to do the internal work. They were able to say that it shifted them from just seeing the woman's body as sexual to actually helping the baby and the mother to reduce suffering and to safeguard the health and well-being of both of them, and to prevent perhaps lifelong injuries to that part of the body, make an easier exit, and to prevent trauma. Fathers wanted birth coaching skills. They wanted the right skills for their role. They wanted to work together with a birthing woman and have her trust them to know how to help. Men wanted to build their family, and so they developed many birthing better skills. So in birth, men wanted to have a role. Most men are fine with being at the birth as long as they know what they can do. If not, it's just being there, and it's confusing for both the woman and the man. Birth is a very time frame activity, and what men learned is that with the skills they had, that they wanted to use the skills early and consistently from the start to the finish. And by using them early, that meant that they became a part of how both they and their birthing partner grew in using those skills as labor or the cesarean progressed. They recognized that being skilled in this activity left lifelong memories. They didn't feel incompetent. The woman wasn't angry with them. The woman felt, you helped. I couldn't have done it without you. You were so important. So the choice really for all of us was to learn skills and use them. And skills were the foundation of how we were growing our families during pregnancy and birth. And we knew that choices was actually a privilege to some, but few. When it came to labor, fathers developed a very important birthing better skill because labor can be very vague or incredibly clear. It's always based on a time frame, and many women experience what's called a niggling labor. And what fathers realized was that they could ask a simple question, which is, what do you want to do now? And often women didn't know what they wanted to do now. They wanted the labor to get on with it. But men could see that women got restless and tired, and they wanted to prevent that and to ease that anxiety. So they just asked that question, what do you want to do now? And when a woman came back at them and said, I don't know, they said, that isn't option B. What do you want to do now? Because if your labor isn't progressing, you have to just get on with living life. And when fathers could do this with women, and when women actually agreed to do it, they both found that they got closer together and that they went about their life. And then when labor started to get active, the woman wasn't tired, and they had been using skills all along. So they used skills at the beginning, and they kept using skills, whether it was hard or they hated it or feared it, no matter the situation. And they adapted their skills moment to moment, working together. If the woman was having a cesarean, they just used the skills on the way to the hospital while being prepped or in surgery. Women are always doing that birth, and men can always use skills for themselves, even if they're separated for the woman from the time she gets into the hospital and the baby's born, or while she's being prepped. What men taught me is that they wanted to grow as a human being by having appropriate skills in pregnancy and birth. They loved preparing the woman's body for birth. They enjoyed being involved, and they knew that they were protecting the mother and the baby by helping the mother's body open up for this big object to come out. And they loved helping the woman cope during the birth and to ease the birth process for both the mother and the baby. And they also really understood how learning birthing better skills can aid in the recovery after birth and to prevent so many of the postnatal problems women experience. And at the bottom line, what men understood was happy mother and baby equals a happy family.